board. And with me today this afternoon are a couple of colleagues, Member Tom Walsh and Member Jessica Holmes. And we also have our Executive Director, Susan Barrett, and a number of staffers here with us as well. I see there's a lot of people here, and I want to thank everyone for coming. I also see the healthcare advocate, of course, and I see Mr. Bachner from MVP. And I see that Don George, the CEO of Blue Cross, is here. And I also see that Tom Galanka, the chair of the UVM Health Network Board of Directors, is here. And Mr. Garland, who is also an executive at Blue Cross Blue Shield. I don't know if we've had this kind of, and Ms. Heinz, the general counsel of Blue Cross. Thank you. I just want to thank those folks for being here. I think this is an incredibly important part of the process to hear from the people and understand all these other perspectives and the experiences that everyone is having with accessing our healthcare system and using our healthcare system. And I think a relevant topic to today is affording our healthcare system. So I did want to recognize those people and thank them for attending and being a part of this process. It's very impactful to us board members. And more importantly, I want to thank the public who is here to provide feedback and input as part of this process. It's your own time. You don't have to be here. And I really appreciate you volunteering to help us try and solve some of these problems. So with that, I'll just open it up to public comment, and people can just use the raise the hand function and share any perspectives that they have with us. And I'll call on people in the order in which their hands go up.
I don't know how to raise my hand.
Okay, we can do the person who doesn't know how to raise their hand first.
Okay. Oh, well, I'm still looking for my notes on what I wanted to say. My wife is saying she can go first, but I don't know how you would recognize her on, she's also a dial-in.
Why don't we, so I've got you.
Our internet went out.
Why don't we start with you, 6921, and then what's the last four digits of your wife's number, and then I can call on her second.
9970.
All right, good that you know that. Okay, go ahead, 6921.
Yeah, I suppose it is. I'm looking for my comments. Here they are. All right, my name is Dave Seneschal. I live in West Charleston. My community and I are very concerned about how rate increase requests, coupled with state and federal budgeting issues, are affecting our right to access health care services, which residents of Vermont are guaranteed by statute. The high utilization of low-profit services and underutilization or slow collections for revenue-generating services is not our problem to fix. The board was chartered to ensure that we don't need any sort of rigid allocations or outright cuts to critical services. Service cuts will lead not only to an unhealthy population, but also to its impoverishment, which serves nobody's interests. As a whole, our state healthcare system needs to be expanded through greater participation. And yes, I realize Vermont is aging. Older Vermonters are fully paid into the system, and these people, my family and neighbors, must be protected along with other residents lacking concierge coverage and not deprived nor impoverished. I am not participating in Health Connect, so in that regard, I'm perhaps not a typical giver of comment to the board. I'm on a Medicare plan right now called Vermont Blue Advantage, which licenses its name for Blue Cross, but is not Blue Cross, and yet appears to be entitled to the same rate hikes. Of course, my premium increased. My deductibles have gone up twice. My co-pays appear to have been raised 3 times, or at least twice with respect to Part C, and the most recent rises exceeded 100% from where I was a year ago. One of my 3 medications was dropped from the formulary. It was already expensive and now represents a major liability in my personal budget. My primary care is provided through North Country Hospital and is on your chopping block. Provisions of the United Healthcare Law that the board was founded to protect and maintain, particularly with respect to affordability and access, ought to have been funded and still ought to be. My community and my state need a system that fully meets the real needs of my wife and my neighbors, the public, as well as those who others who benefit from the services being provided by institutions like North Country Hospital, and they must provide their fair share of equitable financing. The board's mission has drifted to cutting resources and costs. That wasn't your initial charter. The latest rate increase request does not need to be bargained down a couple of points in typical fashion. It must be rejected. The reimbursements industry needs to be stopped from playing what amounts to shell games. This is not our problem to fix. Thank you.
Thank you very much. I'm just going to acknowledge one other piece of the state's work, which has been very intense for several years, which is a transformation of the healthcare system. There does need to be change. We can't reject the rates and then also expect that there's going to be no changes on what it's being paid for, right? I mean, if you reject the rates, there's not the money for all those services. I think the needle the state is trying to thread is ensuring the right mix of services and that essential services aren't cut and that non-essential spending, which there is plenty of in the state, is what's targeted first so that we can have more affordable rates and make sure that we don't lose access to rural health care. But it's not
Primary care.
That's a huge priority for the board. We've taken immense steps to support and bolster up primary care through some of our regulatory actions with OneCare and hospitals and through some of our rate review decisions. Yes, primary care has got to be, in our mind, first and foremost, one of the things that's protected and bolstered in the state.
You're muted, Deb. Okay, thank you very much. I'll let you move on to the next caller.
Call on to the next caller, 9970. I think if you unmute, you can go ahead.
If you're on the line, if you dial *6, you can unmute yourself on the phone.
Okay, why don't we go to Mary Garish? Mary Garish, are you there?
Thank you. Thank you. I finally got unmuted.
Mary Garish, are you there?
Yes, I am. Can you hear?
Yes.
Yes. Can you hear me now?
We can, but for other people who are not speaking at the moment, could you please mute your line? Not speaking at the moment, please mute your line.
Okay. Shall I begin?
Yes, please. Yes, please.
Okay. So I appreciate this opportunity. I worked with many of the other people on this call back in 2011 to be a human right in the state of Vermont, not a luxury. One of the results of that act was the coordination of this board itself. And the goal of that board was to make sure that every person in Vermont had equitable access. That doesn't mean affordable because affordable varies depending on your particular financial situation. Equitable means everybody gets what they need. And I'm sure that you all know this, but I will say that one of the things that everybody was very specific about in establishing this board was to keep all of these rate hikes from happening and keep people from dying, because they are dying from not being able to afford their health care. And the worst part is some of them are not getting health care because they fall into that cliff where they can't get Medicaid, but they also can't afford the premiums. I am still working at 75 years of age, mostly so I can afford my insurance premiums, which, thanks to Blue Cross, also just went up immensely. My deductibles went up. My copays went up on medications and other things. And I implore you, please recall what your mission is, and that is to serve the human right to health of the people of Vermont. Please deny Blue Cross. And I understand what you were saying earlier about, you know, medical care is expensive and we can't just do away with things. No, we can't. But could we put limits on the salaries of the top executives at the insurance companies instead of giving them a raise every year? Would that help any? So I'm sorry, and I don't mean to sound antagonistic, but please, please do your job that you were formed for. Thank you.
Thank you for your comment, Ms. Garish. And you don't sound antagonistic at all. I think that Vermonters have a right to be frustrated. And I think I am as well, and the other board members. So we appreciate your candor and your perspective on this. Grace Powers.
Hi there. As a 27-year-old, I have been either uninsured on Medicaid or on an inadequate healthcare plan through college. I've experienced debt collectors calling me at age 18 in my college library while studying for exams to pay $2,000 for urgent blood work. I've worked hard to avoid a situation like this ever since and don't wish anyone to go through such an experience at any age. This past May, my Medicaid was terminated because I made $20 an hour. I am now on Blue Cross Blue Shield. I chose this plan because the federal premium subsidies made it affordable and possible for me to have surgery I've been waiting 5 years to undergo. This surgery was necessary for my quality of life and ability to keep working. Without insurance, this surgery would have cost $24,000, forcing me to forego the surgery or go into deep medical debt. If premiums go up next year and with federal subsidies sunsetting, I won't be able to afford Blue Cross Blue Shield and likely can't afford an MVP plan, making me uninsured. I'm urging you to reject these rate increases because it will make accessing any healthcare unaffordable for myself, my loved ones, and my community. Without insurance, I won't be able to access primary and preventative care. My only access to healthcare will be going to the ER once my health deteriorates enough to be treated there. It is your responsibility to promote and protect quality care through the rate review process. Going to the ER instead of seeking primary care is not quality care. I have experienced firsthand our cruel profit over people healthcare system. I have watched it helplessly as it failed my friends and parents while profiting off of their pain. I recognize this is a larger systemic injustice. I invite you, as members of the board, to use the power you have and responsibility that comes with it to strongly advocate for a universal healthcare system, one which guarantees us dignified healthcare as a human right, not a luxury. Thank you so much. I appreciate you listening.
Thank you very much for your thoughtful remarks, Grace. I appreciate you taking the time to share those with us. Amy Lester.
Oh, there we go. I'm unmuted. Hi, thank you. I am, my name is Amy Lester. I live in Plainfield, and I am calling actually for my son. He is a roofer, and 4 o'clock on a sunny day is not a time that he can come to talk about his experience. So I'm here to talk about his experience, which is he is not offered a plan through his workplace. He works in Addison County, and he's 28 years old. He does important work that nobody really wants to do, and AI is not going to take over roofing. So he's here, staying in Vermont, went to high school in Vermont, staying here, wants to settle down. And he is currently on a subsidized plan that will sunset this year. So he is going to be moving into purchasing a full Blue Cross Blue Shield plan. And my understanding is for individuals, they rate between $600 and $800. I can guarantee his truck payment is going to take precedence over health insurance. And that scares the living shit out of me. Excuse my language. So I am thankful that you're taking this testimony. I think 4 o'clock on a weekday is a little interesting for people that work and can't make it. So I guess I don't think that this is actually an open and transparent and accessible way for people to comment. And I guess the other thing is, like, I really am hoping that you can choose to be on the side of Vermonters. You know, this is what you are tasked to do, is to make sure that we have equitable and accessible and transparent healthcare. So, yeah, I guess I'm imploring you to take up this action, take this up, and yeah, fight for Vermonters, not for Blue Cross Blue Shield. Thank you.
Thank you very much. There's a number of other ways to engage in this process. If the time is not perfect for everybody, there's definitely times that are better for some and worse for others. But we have an open public comment period that I'll make sure, I know we've advertised it, but we'll re-advertise it to make sure people are aware that you can submit written public comment. And then also during every one of the hearings on this, we have public comment period during the hearings, which is always another avenue. And I appreciate your son's work. My brother is a carpenter in Addison County and often on roofs in Addison County at 4 o'clock himself. And I'm aware of the dangers that work has and the need for healthcare. I think about my brother and his friends and their ability to afford healthcare too. So I appreciate you taking the time on behalf of your son, Miss Lester, very much. Miriam Tatum. Miriam Tatum, if you're here, I think you can go ahead. I can come back to you. Ellen Schwartz.
There. Okay, am I unmuted now?
Yes, we can hear you.
Okay, good. And I should probably lower my hand, but I'll figure that out later. So I live in Brattleboro. I am on Medicare, so I'm not one of the people who's going to be personally impacted by the premium increases if you approve them, which I'm hoping you won't. But I am, however, concerned about a downstream effect on the ability of me, myself, and others in my community to access healthcare. And it's an effect you're probably aware of. So I know that your board has been dealing with things regarding the hospital budget, so you're aware of the precarious financial situation that many of our hospitals are in, including my own local hospital in Brattleboro. Officials are estimating that 45,000 Vermont residents could lose access to Medicaid as a result of the massive federal cuts. So if on top of that, hundreds or even thousands more end up losing health insurance because they can't afford the plans that you're here talking about today, that is going to affect the ability of health centers and our community hospitals to survive, because they are going to be required to provide a lot more urgent, up at the emergency room, and they won't have the income coming for people with insurance. As an elder in my community, I count on my local hospital for a variety of services, as did my mother, whose life was literally saved by being able to get quick access to Brattleboro Hospital when she needed it. So if our hospitals lose insured patients, as I said, they're going to be forced to provide more care to uninsured people, through the emergency room, which is not ideal either medically or financially not for the patients or for the hospital. I feel that our healthcare system is imploding in front of our eyes, and that we are looking at potential closures and closures that have already happened of health centers and hospitals. We're looking at unaffordable care. We're looking at insurers who are concerned about bankruptcy. If there was ever a time when bold action is needed, it is now. This current system is facing a tsunami if we're not already in the midst of one. And in the midst of this crisis, I implore you to take bold action to save our healthcare system, starting with rejecting these premium increases. But that's not enough. We're going to need more if we're going to have a system that actually provides access to affordable quality care for all, which is what Act 48, the law that created the Green Mountain Care Board, promised to us. I urge the board to use what power and influence you have to push for systemic solutions to what is clearly a systemic problem. The law that created this board envisioned such a solution. Green Mountain Care was supposed to be for everyone in Vermont. Please be proactive in advocating for this before we see more people losing health insurance and more communities losing our hospitals and health centers. Thank you.
Thank you, Ellen. Really well said. And I think that your comment really speaks to what we are living every day, which is you have an insurer with serious financial trouble. If they go under or can't pay claims, if that unfortunate risk bears fruit, you have many people that won't be on insurance. And it will be some of the problems that you mentioned. More hospitals will face closure, more FQHCs, more everybody will have a problem if the insurer is insolvent. And there is a level of risk around that. I think rejecting the rates outright would be beneficial to parts of the system and for affordability potentially, but also potentially very, very risky to access to care and solvency of some of the providers you mentioned. I think the last thing you hit on, the systemic problem, is really, really key, and that's what needs to be solved. And our partners at AHS are leading a health system transformation project right now that's been going on for about a year now after the Oliver Wyman report, so that we can have these services without having these excessive rate increases. We shouldn't be in a place where everywhere you look, there's not enough money. Vermonters can't pay more. The insurance company doesn't have enough money. Brattleboro Hospital doesn't have enough money. The FQHC doesn't have enough money. No one has enough money. What we're doing won't work. In terms of advocacy for Green Mountain Care, I would encourage you, and I presume you and others have, but continue to meet with your legislators. That would be something that needs to be funded and pushed by the legislature and the governor. And I think it's something that you should reach out to if you continue to support that vision that was now, I think, 13, 14 years ago. So thank you for your very thoughtful comments. Jake Castro.
Hey folks, first time using Teams, so hopefully we've got good reception here. All right, so I'm going to keep it simple. I'm Jake from White River Junction, and honestly, these rate hikes are yet another year of these companies gouging the average Vermonter. Year after year, we've seen these healthcare companies and insurance companies across the U.S. and the state gutting services, closing hospitals, cutting costs, denying claims, and ultimately all of that kills people. And year after year, these same executives go before the Green Mountain Care Board and hat in hand, wallet bursting at the seams with blood, and saying that they need to increase costs, all while never taking personal responsibility for the healthcare system they've undermined and dismembered. Honestly, I have not seen anything that justifies these increased rate hikes. I've seen these businesses act recklessly and endanger our healthcare, and we don't have a fiduciary responsibility to their stockholders to fill up their bank account. Honestly, these CEOs don't take pay cuts, they don't forego bonuses, they don't look in the mirror to see how they can help us. And so they shake us down year after year and pocket the meager change. And we know that this hearing, I believe you might want to hear the voice of citizens, but the timing of this meeting says that we don't. because the people who are affected by this are all still stuck at work. And so, honestly, healthcare is a human right. It should be a human right to everyone in this state. And I don't believe that these companies have a right to profit off our misery infinitely. So I would say that please reject all these rate increases. As it is, the state is already suffering from a rash of hospital and clinic closures and reductions of services and a housing crisis to boot. I can hear that you all care about this. I hope you remember who you guys serve, because we're paying attention and we'll remember how this is resolved. Thank you for your time.
Thank you for your time, Mr. Castro, and for your comments. Again, just to reiterate for folks, there is an open public comment period every single day on this. So there is an opportunity if this time doesn't work, and also at the hearings. So I'll make sure that that is noticed and everyone knows about it. But we take public comment. Every single board member reads every single comment at least once. And so we really value those. And I think we often actually cite them in our opinions. We highly value the input. I think it's an incredibly important piece of this process. I think it's true. If you just hear from an entity that we regulate, they make very good arguments as to their needs in their context. And to do a good job, you have to understand all the other contexts and balance them all. And that's what we're trying to do. And so I greatly appreciate everyone and you, Mr. Castro, for making the time for us so that we can try and represent you in the state's interest as best we can. Miriam Tatum, I see your hand is still up. I'll come back to you. Okay. Walter Carpenter, I see that you came off of on video. Do you have a comment, Walter?
Well, I hadn't raised my hand, but anyway, I do. I'm at work, Owen, so if there's any background noise, I apologize. There's nothing I can do about it. I took some time off. I kind of took a hiatus from work. The comment I had is kind of builds off of what Jake said and what Ellen said, but it's not a question and it's not directed toward anyone, but it's directed toward all of us as a state, a country, etc. I want to ask why it is this system thinks so little of us, cares so little about us, only cares about the CEOs and stuff like that. So any of these rate increases are going to hit us really hard. And they're thinking of their solvency, and the CEOs, no doubt, are thinking of their salaries. But every time we come up against this, it's always austerity for us. We can't afford this. We can't afford single payer. We can't do this. Yet the CEOs, millions of dollars in salaries. And that seems to be all right. And it's not directed towards anyone here. It's not, the board or anything like that, because the board operates within the parameters set by the legislature. But we know the state government will never act single payer. The governor will never sign it for reasons that have nothing to do with healthcare at all. They will never, ever even entertain the idea now. It's like they're all looking out for UVM before they look out for us. And I want to know the reason why.
Thank you, Walter. On the executive salary, since it's come up a couple times, I would point to some new legislation that was passed this year that gave the Green Mountain Care Board greater authority over looking at executive compensation. It's been a topic in a number of hearings, and the board has cut executive salaries. We reduced the salaries at One Care Vermont. We were appealed by One Care Vermont. We won the appeal. We have the authority. It is something we will be looking at and something we will be using in the appropriate circumstances. I think people are right to be frustrated about the salaries. They're really high, and the system has failed the people. And, you got to be accountable for that, period. And your job is not to just do well by your organization, but to do well by the state. So what we did with the legislature and through some really strong legislative leaders is we advocated for legislation that required executive compensation to be aligned with state goals. And that means not just the institution's goals, but the state's goals. And that includes affordable health care. So we will be looking at that and we'll be making sure that that's happening. It needs to pull through. And I share the frustration. There are a lot of executives who have made a lot of money and the system has failed the people.
It has. Can I ask one more question, Owen? Again, it's not directed at the board, really. It's just kind of in the open air here. When we say affordable healthcare, exactly what do we mean by that? Again, it's not, I mean, it's for the, I'm not accusing the board. As you know, I back the board, but I'm just trying to get it out there. It's exactly what is affordable healthcare and who is it affordable for? But
Yeah,
I'll leave it with that thought. Thanks, Owen.
No, I appreciate it, Walter, and thanks for making the time. Affordable healthcare is not this. I'll tell you that. The board last year began a process of implementing affordability guidance and affordability guidelines, which was part of the insurance process this year. So we actually have a template and data that we look at to evaluate how unaffordable plans are. And it's based on income at different levels of income. It's based on the cost. It's based on the max out of pocket. It's based on all those factors. And with the subsidies for some particular people, it is affordable. Without the subsidies, even with the subsidies for a lot of people, it's just not even close. Now, we're focusing on healthcare in this conversation and in most every conversation I have, but the mission is not just affordability. It is also sustainability and access and quality. And those things are often in conflict. If we reject the rates and we give the hospitals nothing, Brattleboro Hospital is going to close more services. We're going to see hospitals have real serious financial challenges. So that's a conflict and a tension that we are trying to balance. My personal view is that in this state, it's gotten out of balance by a pretty significant margin. We do have the highest premiums in the country, and we have really high rates in front of us, and that's not going to work. It's not a sustainable way to finance a healthcare system, and we're going to have to take some bold action. There's no question, but we're going to have to be mindful of those other components of our mission that are very important to Vermont too. Those are for Vermont also. But thank you, Walter. I always appreciate you coming to all of our hearings and making so much time for us.
Thanks, Owen.
Alex Leclerc?
Forgot the mic button. I, just for the record, Alex Leclerc from Essex. I am the CFO at Essex PT and Georgia PT. So my job, I'm the billing person. So I look at people's benefits. I can see which patients have good benefits and which ones are going to struggle to pay a bill. I have gotten a lot of phone calls this year, more than the last 2 years, about people not being able to afford their bill. And we're not a bank, and we offer 0% monthly payment plans for people because I want them to get care, and I know my providers can get them the best care at a lower price than the hospitals, specifically UVM, who's right down the road from us. Mr. Garland, when he was speaking earlier today, I was shocked. Well, I wasn't really shocked to hear that UVM doesn't really negotiate based on the rate increases. So if the Green Mountain Care Board approves a 0%, they just kind of shift coding around and get around it. And that's not really how I like to negotiate with the insurance companies, because the first thing I think about is if someone has a $10,000 deductible, they're not going to be able to afford anything, and they're just going to avoid care. And my real big concern is a lot of people are going to switch from Blue Cross to MVP, and if MVP can't handle all of the people, they're going to switch to Cigna, United, or Aetna. And from experience, there are a lot of PT clinics, the industry that I work in, that those contracts that those providers have are not even close to Blue Cross or MVP. And a lot of them are going to go out of business, which is going to make access worse. I don't want to see those clinics close or get bought out by venture capitalists or private equity or the hospitals. That would be terrible. but I'm in the situation where our business is not big enough to qualify as a small group. So all of us employees who are single are on the exchange, and we don't really have the margin to get a plan. And it's extremely concerning to me because the only way to get the margin in order to get one is if we drop Medicare, Medicaid, and the VA. And to me, that's morally wrong to do. Those people deserve our care. And I guess one more thing too that I didn't mention, we have a mobile PT division that goes out to people's homes and gets them care so they can live in their home longer instead of going to assisted living. Vermont Blue Advantage, well, I should say Medicare, Vermont Blue Advantage, all the Advantage plans, we lose money on that care. It's essentially community service. I like doing that. That's what I want to do. But Blue Cross will not, sorry, Blue Cross people, they will not increase our Vermont Blue Advantage reimbursement rates to cover the care for those people. And I can't tell my PTs, hey, the insurance company is not willing to reimburse us to at least I don't want to make money on those visits. I just can't be losing $30 a visit. That's just not sustainable. If it's $5 to $10, we could get more PTs. And I guess the one more thing that just really irks me, UVM is sending so much money to the New York hospitals to keep them afloat. And what's going on, as far as my sales background, negotiating background, they're basically leveraging the New York hospitals, saying to the insurance companies, you need to pay us more so that those patients don't end up at UVM and cost you more. That's what's going on, at least in my opinion. It's so crazy to me. And then they have, it's either 300 million or 1.1 billion sitting in the bank account. And I would say a majority of it is Blue Cross's money. So I'm just really, really afraid for what is going to happen next year. I mean, I still live at home with my parents, so at least I have a roof over my head. But there are a lot of people that are going to struggle big time. I mean, I don't know. I don't want to break HIPAA law, but let's just say multiple patients have gotten raises and they lost their Medicaid, and they're calling me in tears saying, we want to pay you, but we can't afford one visit. That's just not okay to me. And I don't have a free care budget in my budget. I mean, I wish I did, but we don't get hospital rates, and nor should we. And I think, frankly, the PT program at UVM is ripping people off. It is the CPT codes that they use, manual therapy and therapeutic exercise, are the two lowest reimbursing codes on the Medicare fee schedule. Those are their two highest reimbursing codes, just like Mr. Garland said today with the screw example. That should not be happening. Sorry, I am trying my best to not swear because my mom would kick my butt. And lastly, sorry, Member Holmes, thank you for bringing your students to the legislature. I know my legislator was very, very shocked to hear what was going on, and I would encourage you to keep your students going back there because they need to be educated. And that's my comment. I'm also excited to hear what Patrick has to say because I feel like he's in the same situation I'm in. So thank you.
Great. Well, thank you very much, Alex. And Member Holmes has some incredible students. We've had some for interns, and they're remarkable. And it's not surprising given who their teacher is. Mr. Flood.
Chairman Foster, can you hear me all right?
Yeah. Hi, Patrick.
Hi. I'm sorry that for some reason my video is not working. But as long as you can hear me, I do have a couple of comments. I
Please.
think, we all know that we have a pretty dysfunctional healthcare system in Vermont. A very expensive dysfunctional healthcare system in Vermont. But I don't believe the average Vermonter has any real understanding of why and what's the cause of all that. Myself, I have been engaged in this discussion for over a decade. When the first all-payer model proposal was made, I said, this is crazy. This will not work. This is not what we need. 10 years later, here we are, and we're looking down the barrel of a impending bankruptcy of Blue Cross Blue Shield. If as well as I do, if Blue Cross Blue Shield goes bankrupt, our system risks total collapse. I don't blame Blue Cross Blue Shield for the situation we're in today. I've been watching this for a long time, and it's very clear to me that the source of all the problems that we're having is the UVM Medical Center and the UVM Health Network. They have been gouging Vermonters for at least a decade, if not 2 decades. They have put all that money in the bank. They have huge reserves, while the rest of the system is falling apart. I credit the Green Mountain Care Board and yourself, Chairman Foster, with the leadership of trying to wrestle this problem to the ground. I think you have done great work over the past couple of years, but it hasn't been enough, because here we are. Now, maybe I'm misreading all the information that I have gathered, but it seems to me Blue Cross Blue Shield is in deep trouble. And we have to take steps to preserve that. I don't think they're the issue. And yes, their CEO makes a lot of money, but even if you cut his salary in half, it's not going to solve the problem. The only way to solve the problem that we're in right now is to severely restrict the rates that we pay, or that the insurance companies pay, to the UVM Medical Center. That's where the money is. And as Willie Sutton would say, you got to go where the money is. And the money is there. I know they have very powerful political friends. And I know that they will think of ways to get around whatever you come up with. But I think it's not enough to just cut the rates that the hospitals are asking for. I think it's not enough to even give them 0 increase. I think we're going to have to reduce their rates significantly. It wasn't that long ago that Blue Cross Blue Shield said publicly they could reduce their rates quite a bit if $200 million, if the healthcare system, basically the cost of the healthcare system, was reduced by $200 million. UVM has that money. There's no question that they could take that hit and survive. And they're the ones that need to take that hit, because they're the ones who have been taking all the money all these years, and the rest of the system crumbles. So I don't blame the Green Mountain Care Board. I think you have done yeoman's work. I thank you for that. It just is not enough in the situation we're in. And I think it's kind of weird that we're doing a Blue Cross Blue Shield rate review before we do the hospital reviews or complete them. Because what we need to do is cut the hospital rates primarily, and maybe almost entirely, UVM Medical Center. I appreciate the problems at the smaller hospitals and but I think that the Green Mountain Care Board can manage that to give each hospital the budget increases that they need. And that can be paid for by reducing what we give to UVM Medical Center and take back, in effect, a lot of the money that they have been gouging over the years. If we fail to do that, we're going to be back here next year with the same issues and the same question, if we get lucky and Blue Cross Blue Shield doesn't fail. So I know you know all this. I'm not telling you anything you don't know, but I am encouraging the board. As I said, the average Vermonter has no idea what's going on and what's at stake and how at risk their health care is. But as one person who does have an idea about what's going on, I'm saying to you that the board really needs to cut the UVM Medical Center's expenditures, budget, and rates. You have to. It's the only way to solve this problem. And I'll stop with that. Thank you very much for the time.
Yeah, thank you very much, Mr. Flood, and thank you for all your engagement and your public comment that you provide the board. Ever since I've been here, you've been very engaged, and I appreciate the comments and insights. You know, in terms of like blame for where we are, UVM has certainly a fair amount. There's no question it's very expensive, and that's part of the problem. But I would say it's not alone. You don't get a problem this big and this serious by one bad actor. I think Blue Cross has some blame. I think the Green Mountain Care Board has some blame. I think I have some blame. I think the ACO has some blame. It's a pretty deep problem. And I think at this time, we all need to look pretty hard at what we're all doing and really reflect on that and ask ourselves, is what we're doing working? And I think, you know, I have a leadership role, and part of that means you got to say when you messed up. And I think I messed up and the care board made a mistake when we approved UVM's NPR in 2024. I think that was an error. We did the right thing on the rate. We reduced the rate a lot, but we didn't reduce the NPR enough, and that proved to be a mistake. I think last year we did some enforcements. In hindsight, I might have done them differently and more aggressive. We have, as a board, recognized this. Every board member has recognized the problem we're in. We've reflected, and we've changed course in quite a number of ways. I really think you're right. We haven't done enough, and it's not just within the care board's authority, right? There's pharmaceutical costs that we have no authority over. You know, it's not UVM's fault that pharma costs as a nation are going bananas. That's not Blue Cross's fault. That's a problem we have to live with on some level because the feds can't do it. We have one of the most powerful and effective senators in the country. He can't solve that problem. We have one of the most popular governors in the country. He can't solve that problem. So, you know, there's some things that we're going to have to deal with in our system, and being a rural healthcare system will be more expensive and more challenging. There's no question. The scale makes it hard. I'm not excusing where we are at all, but we're not going to fix this overnight. And when you take really, really bold action, which I'm not afraid of doing, there are risks with bold action, and you've got to balance those risks. And when you have a system living on a pin like we have, those risks are really acute and they have serious consequences. So we're trying to balance all that and thread a needle so that we don't have that implosion that people have talked about. And I don't think that that word is hyperbolic. I really don't. So I appreciate the comments. I do think that there's opportunity for UVM to improve its work. I would say that we have had engagement with UVM, unlike we had, I think, ever. They have some more serious involvement at their governance level. They have a liaison now, an independent liaison who is a very serious person with serious chops and serious capabilities and a really good team trying to help. And so I think that there has been ground made, but I think there's more opportunity at every place. The ACO is going away, but there's a lot that everyone needs to do, and we're going to have to just do it. Miriam, I see that your hand came back up.
Miriam, it's *6 to unmute.
And then there's another hand raised. It looks like a phone, but I can't get the phone number. Hang on. Here we go. 9970. I think is Mrs. 6921.
Hi, my name's Debbie Pelletier Fenichel. I'll be directly affected by Blue Cross Blue Shield rate increases, and we will all be affected by cuts to for Vermont Health Connect plans. I work for Northeast Kingdom Human Services. I've been there for 4 months. Our Blue Cross Blue Shield plans have changed this month. It's more expensive and it will change again in 6 months, which means we only have 6 months to meet the current deductible. I'm an educated and I work a service job because I like to give back to my community. Many of my coworkers have opted for less expensive plans with higher deductibles. Many service workers cannot afford health insurance costs, even with employer contributions. I applied for a job I couldn't accept because it was a small nonprofit agency that couldn't afford to offer a health plan at all. By service workers, I mean college-educated professionals who care for our children, elderly, and handicapped family and neighbors. Devaluing service workers, by devaluing service workers, you're also devaluing the people that we care for. My husband and I moved here just over a year ago from Massachusetts. Friends asked, "But will you have a hospital way up there?" And proudly I said, "Oh yes, North Country Hospital is only about 20 minutes away." Little did I know that the hospital that had been there since I was a child was in danger of closing. We were mandated to have universal health care over a decade ago. I implore Green Mountain Care Board to finally, in light of current crisis, act quickly to advocate for the real and basic health care needs of people of Vermont. So much time and money has already been wasted. It's time for big changes, but closing a hospital and leaving rural Vermonters without access to health care, primary care, emergency care, maternity care is not an option. We not only need our hospital and its services, we need more affordable access to health insurance, not more increases. Thank you.
Thank you, Ms. Pelletier. Shasta Fowler.
All right, can everyone hear me?
Yes.
So I'm Shasta. Okay, great, thanks. I'm Shasta Fowler, and I live in Montpelier. I have a 3-year-old. You might have seen her on the screen. And so I, similar to Ms. Pelletier, I work as a direct support professional. And so a lot of our funding comes from Medicaid, but one of the biggest costs that our agency has is healthcare costs. And I just think about how those rate increases are really impacting the work that we're able to do for the people that we're designed to serve. So like we can't help people and help fix things or do what we're supposed to do. You know, designated agencies were basically privatized by the state, you know, since deinstitutionalization, Brandon Training School. So it just is so messed up that the state can't protect us as workers. And I just want to see my coworkers be able to afford our lives, and not have our family members getting kicked off of plans because the agency can't afford it. And I worry about too what's coming down the line with Medicaid cuts. It's just kick us while we're down. So I just, I think about how there's 816 open positions for the work that I do across the state. Bye, have fun. Sorry. Yeah, life with a 3-year-old. And yeah, so we desperately need workers, and we're not going to get them if they can't afford to live in this state. Like, it's just so messed up. So I really want to see like the Green Mountain Care Board kind of like right this ship. I just feel like Blue Cross Blue Shield, UVM Health Network, they've kind of lost the plot. Like, this is not going to work for anyone if we can't afford to live here. We're not going to have people to do the jobs that need to get done. You can't AI my job, as someone else said. So, that's where I'm at. Thank you.
Well, thank you very much for those comments, Shasta. And a lot of these healthcare costs are very antagonistic to the state's demographic goals and supporting young families. So it makes it is a bit of a spiral that's tough to live in. Are there any other public comments? Okay. I don't have the timing exactly in my head because I think it's shifted a little bit on when the board will make decisions.
Can you
We've
hear me? I'm
complete.
trying to call in.
Oh,
I'm
I
sorry,
heard
I'm
someone
trying to
with a,
call in, but
yeah.
I can't raise my hand on the phone, so I don't know how to raise my hand.
Oh, I'm sorry. Yeah, go ahead. Please.
Okay, let's just pull up my comments. So I can talk. Okay. So, thank you for holding us today. When Act 48 became law in 2011 and established this board, I was encouraged, excited, and hopeful for the future that a stable and consistent healthcare system could bring to the state of Vermont. I understand the board is limited in its ability, but some 14 years later, it seems that this board has abdicated its responsibility to transition us to a single-payer healthcare system, which would end our crisis once and for all. We should not be concerned with the solvency of the insurers profiting off the medical distress of working people. We should be running them out of business and removing profit from the healthcare system. Every year, the insurance companies tell you that they need more money in order to survive. But what about our survival? Well, we will never pay them enough that they won't ask for rate increases year after year. In the context of a marketplace, private insurers have absolutely no incentive to actually provide care for their customers. Blue Cross makes more money if we die. What we end up with is the same never-ending cost increases that we already cannot afford. As a public school employee, my insurance is pretty good personally. However, each year, health insurance is a major factor in school costs, an issue raised in the state's new education law. To address this issue and healthcare affordability more generally, I would implore you to follow the law and ensure full access to healthcare for all Vermonters under a cost-effective single-payer healthcare system. And that's what I had written, but I just wanted to add that the health insurers are the ones that make this expensive. Medicaid and Medicare have some of the lowest administrative costs for administering healthcare in the world. In the world, they have some of the lowest administrative costs. The administrative costs that we spend on our private health insurance companies is where the problem lies. It's not about the healthcare workers. It's not about the hospitals. It's about the health insurance companies. They are profiting off of us dying, off of them denying us medical care, and this is the only way they make money. So we need to stop playing games with them. They're not playing games with us, quite frankly. They profit more when we are denied care. And that is what we should be understanding when we're entering into negotiations with people who have blood on their hands. So it's not a time to negotiate in good faith with these people. It is time to take their power away from us, from them, over us. We need to remove profit from the system. There is no other way to administer healthcare long term. Thank you.
Thank you very much. And just on single payer, that's not something the board has any authority to move the state to at this time. So again, if people want to advocate for single payer, the right place for that really would be the legislature and the governor's office. They would need to have a financing plan and the money to do it. So I think if that's something that people are interested in, make sure you reach out to your legislators and have your voices heard. And I appreciate the thoughts and the comments. Anyone else on the phone? Okay, I think that will conclude our public comment session. I'll just give a couple timelines so people have them in their head in case they want to provide additional thoughts or comments. We have public comment open on these rates until July 28th. The board has finished the hearings on both insurers' requests, and I believe the board will be issuing decisions mid to late August. I think it might be August 22nd now is the current date scheduled for the board's final written orders to be published. in which we'll decide what the right outcome is from our perspective. We have hospital budgets starting, I think, around August 1st or so, and that'll continue it throughout August. And we'll be issuing decisions on the hospital budgets. We'll vote on them by September 15th and written orders by October 1st. And I encourage people to share their views and perspectives in connection with that process, as these all are intertwined. I appreciate people taking the time out of their lives to do this for the state and to participate. It's very important, and I appreciate it. And with that, I will adjourn the public comment session, and thank you all very much, and have a good night.